Hey guys, it's Dr. Mark Jordan once again with Fearless Physical Therapy. I'm here with my son KJ.
So,
How you guys doing? Today we're going to discuss a little bit about low back pain and show you a few exercises to do for that. Okay, so with low back pain, people hear a lot of things. They hear that they have a herniated disc or they have a bulging disc or they have degenerative disc disease. All this stuff sounds really scary. Most of the time, it's due to normal aging. So, most people end up having it. There's been studies that have done that said something like 30% of 25-year-olds, about 40% or more of people my age, which is the 35 to 40 range, have some type of back issue. And then as you go older, it gets higher to it's almost 75-80%. So back issues, you're most likely going to have some type of back issue at one point in your life or another. The thing to remember is that your body is strong. Your back is a very stable structure that is made to be able to tolerate weight. So exercising is not going to hurt your back. Moving around is not going to hurt your back. Doing activity is not going to hurt your back unless you have some type of systemic or metabolic disorder that makes everything like Swiss cheese. Exercise and loading your back is not going to hurt. It's just making sure you do it right. So today we're just going to go over a few simple, easy exercises to get you moving for your back. They're usually some of the first exercises I do with my physical therapy patients, especially if I don't find a position of preference. What the position of preference is some patients in certain directions, they notice that their back pain feels better. Stand up for me, Kia. So some patients bend forward, go ahead, all the way. Flexion makes them feel better. Come back up, do a back bend. Or bending backwards may make them feel better. Come back up. Now, then or maybe side bending to one side or the other, or even rotation. Now, a lot of our back pain patients have one of these positions of preference. What that means is that position makes their back feel better. So we start off to treating them going into that direction. And then we slowly progress adding every other direction one at a time. Because you can't spend all your life just going forward or going back. You have to incorporate everything else in order to have a healthy, happy quality of life. So we start with that position of preference, and then as you start to improve and we start to build upon things, we integrate one after another to try to get you so you can move in all directions comfortably. May not be 100% pain-free, but it should be comfortable. All right. Oh, and once again, like I said earlier, most people are going to have some instance of back pain in their life. It's a normal experience. It's just understanding that the pain is normal and that you need to continue to move through it. Okay. Go ahead and lay down for me, Kia, on your back. So the first exercise we're going to go over is just a double knees to chest. Now, you can see this ball is a little too big for them, but for right now, it's going to serve our purpose. Like I said, this is a very easy exercise. It promotes some movement in the back, but it has the assist of the ball. So what you do is you take your knees and you bring them up, keep your knees together as far as you can comfortably. Then slowly come back down. You bring it up again, and then back. You want to make sure that you're not going in one direction or the other, that your back is pretty straight, and that you start up and down. That's exercise number one. Nice, good exercise. Usually for most people, it helps loosen things up, and it lets them know that, okay, I can move without it hurting so bad. The next exercise we like to do, so we put the ball more up under the knees, and you prefer it to be more of a 90-degree angle, more of an L shape. As you can see with Akio right now, his angle is a little bit obtuse because the ball is too big for him. But keeping his back flat, I would tell him to rock your knees this way and then back. And he would do all one way. And so the whole time I'm cueing him is to make sure his back is flat on the table. You don't want to be lifting your back up because then you're incorporating other muscles. And for right now, that's not what you want to do. So you do all one way, and then you do all the other way. Now, it's normal for you to have one direction that feels better. A lot of people say, oh, it feels better when I go left, or it feels better when I go right. That's okay. That's the direction we're going to start with. Just having you go to that side. But we're going to incorporate you going into the other side. Because you can, once again, you have to move in both directions. You can't go through life just making right turns. All right. So we're going to lift your legs up. Bring them back down. Bend your knees. Now we're going to do a bridge. So lift your bottom up off the table, Kia. All right, back down. What most people do wrong with this is they make it a ballistic motion when they lift everything up and then everything back down. As you can see in a young kid like him, that doesn't feel good. And so imagine somebody older trying to just thrust it up and then bring it back down. It ain't gonna feel good. So cue them to dig in through your heels and try to bring your knees up to the ceiling. So just kind of lift and back down. And only lifting your back up as far as it can go comfortably. And then back down. A little bit of pain is okay. A lot of pain, no. So a little bit of a twinge, a dull ache, we're going to keep going through that. But if it feels like I just hit you with my hands or hit you with a sledgehammer, no. All right? Go ahead, sit up for me. All right, so this next exercise is a pull-out press. You've probably seen this at the gym. All you're going to do is hold the weight or even a band, and you're just going to push straight out, keep it still, and back. The trick is for this one, you don't want it twisting to the sides right now. You're just keeping it in this plane. Eventually, you are going to add some motion where you go into different planes, but you're going to start off right here. So you're just going to push straight out, keep your muscles tight, and back. Now with the bands, so hold this key up. Okay. We'll get it taut. So you would normally wedge this part into a door. Okay? Push straight out. With both hands. And back in. So push straight out. And you can see he kind of deviates to one side or the other. You want it to try to stay straight in front of your chest. And as the tension gets harder, you see it starts to pull him more. So he has to use more of those muscles to keep him in line. And a good easy progression from this is to do what we call stirring the pot. So what you're going to do now is you're going to take the band and you're going to cabbage patch. So like you're stirring the pot. You can do it with the resistance going to either side of you, or you can do it with the resistance coming in front of you, or even above head or down below. Just however you feel you need to train. So, like I said, these are some initial exercises for your back. Once again, as I said in another video, these exercises aren't meant to treat because I haven't evaluated you. If you want a full treatment, a correct treatment, you want to be seen by a physical therapist that can do a full evaluation of you. Because, once again, there's different physical factors that are going to come into play. There are certain things in your medical history that's going to come into play. Then there may be things like you have a positional preference or a number of multiple other items that are going to affect how we do your treatment. And remember, since everybody's back is different, everybody's going to play a little different. Because I've had some people that say flexion made them feel better, bending forward made them feel better, but only to a certain point. And then we have to add most of the time a rotational or side bend component or all three. So once again, these exercises are just meant to educate, give you a little bit of a jumping on point, but you really need to go see a physical therapist to be properly evaluated for your back pain. We enjoyed talking with you all today. Have a blessed day.